My name is Jonna Warden. I'm a nurse practitioner student, and today I'm going to be doing a neuro exam. Can you tell me your full name?
Tristan Warden.
And your birthday?
1/26/96.
Alrighty, for general survey, Tristan is a 29-year-old healthy appearing male sitting in the upright position. He's well groomed and dressed appropriately for the situation. He appears to be in no distress and is alert and oriented ×4. He's the primary historian for his care, and his vital signs include blood pressure 122/80, heart rate 88 and regular, temp 98.1. His respirations are 16 on room air. He is 6'1" and 300 pounds, and he rates his pain a 0. Alright, I'm going to wash my hands first so we can begin the exam. Alrighty, Tristan, so for the first part of the exam, I'm going to be assessing your cranial nerves. I'm going to start at number 1 and work our way down to 12, okay? So for cranial nerve 1, that is your olfactory nerve, I'm going to have you close your eyes and occlude one of your nostrils. Good. And I want you to tell me what this smell is.
Alcohol.
Very good. Go ahead and occlude the other nostril for me.
Coffee.
Very good. All right, cranial nerve 1 is intact, your olfactory. Next, we're going to move on to cranial nerve 2, which is your optic nerve. And what I'm going to do is first assess your visual acuity. So I'm going to walk away using our Snellen chart. Cover your eye. Tell me the smallest sign you can read.
DHJBS.
Good. Go ahead and switch over.
EFTZ0.
Alrighty, so we have 20/40 in both eyes there. Next, we're going to do a wiggle test. That's for peripheral vision. So I'm just going to wiggle my fingers, and you let me know when you can see them, okay?
No. No. No.
Good. This is also the portion of the exam where we do a fundoscopic exam, but for the purposes of this, we are not going to do that this time. So that means cranial nerve 2 is intact. We're going to move on to cranial nerve 3, 4, and 6, which is your ocular motor, your trochlear, and your abducens. So I'm just going to have you follow my finger. Just move your eyes, not your head, okay? Very good. Cranial nerve 3, 4, and 6 is intact. Next, we're going to move on to cranial nerve 5, which is your trigeminal nerve. And the first thing we're going to do is I'm going to have you slightly open your mouth for me. I'm going to tap your chin. Okay, good. That is to test your master reflex, which is intact. Next thing I'm going to do is I'm going to have you close your eyes. And I'm going to lightly touch your face, and you're going to tell me where I'm touching you, okay?
Left cheekbone. Right temple. Left jawline. Right jawline. Right temple.
Very good. That's intact. And then finally, I'm going to lightly touch your cornea with my cotton swab. Very good. That's exactly what I expected to happen. Your eyes shut. So cranial nerve 5 is intact. Next, we're going to move on to cranial nerve 7, which is your facial nerve. I'm going to have you squish your face together really, really tight. Good. Open your eyes. Smile real big. Good. Puff out your cheeks. All right, very good. Cranial nerve 7 is intact. Next, we're going to move on to cranial nerve 8, which is your acoustic. So the first test I'm going to do is I'm going to rub my fingers, and I want you to let me know if you can hear it.
Yep.
Good. Good. Next, we're going to use my tuning fork to do a Weber and Rhine test for the first part of the exam. I'm going to put this on your head. I'm going to tap it, and you let me know if you can hear it, okay? And then tell me when it stops. Can you hear it?
Yep.
Okay, tell me when it stops.
Now.
Good. Next test I'm going to do, I'm going to strike this, put this on your masseter bone, and you let me know when you stop hearing it. Your mastoid, I apologize.
All right.
Still hear it? Good. We're going to do it on the other side. Again, I'm going to place this on your mastoid. You tell me when you stop hearing it.
No.
Still hear it? Good. Alrighty, so cranial nerve 8, your acoustic is intact. Next, we're going to move on to 9 and 10, which is your glossopharyngeal and your vagus nerve. So what I'm going to do is I'm listening to the quality and the tone of your voice. I'm going to take a peek inside your mouth. I'm looking at your soft palate and your uvula. Very good. Say ah.
Ah.
Good. Uvula is midline, and I don't see anything abnormal about your soft palate or anything along those lines. This is also where I would check your gag reflexes, but for purposes of this video, we're not going to do that. Next, we're going to assess cranial nerve 11, which innervates your trapezius and your sternocleidomastoid muscle. So what I'm going to have you do is I'm going to push down, you push up on me. Good. I'm going to push on your cheek on this side, press against me. Other side. Very good. Cranial nerve 11 is intact. Finally, we're going to assess cranial nerve 12, which is your hypoglossal, which innervates your tongue. So I want you to press your cheek against, or your tongue against your cheek on the inside. I'm going to feel the strength. Good. Other side. Very good. Cranial nerve 12 is intact, which means all of your cranial nerves are intact. Next, we're going to begin the coordination part of this exam. For your first test, I'm going to have you slap your knees and flip them over. And keep doing that. I'm looking for any jerking in the smoothness of your movements. Very good. Next, I want you to point to your nose, and I'm going to move my finger around. Then I want you to point to that, okay? Very good. That is intact. Next, I want you to take your shin and press it along, or your heel, place it along your shin. Good. Do that on the other side for me. Again, I'm looking for smoothness. Alrighty, next I'm going to have you stand. Go ahead and walk away from me. Looking for any sway or arm movements. Go ahead and walk back towards me. Stop. Walk on your toes. Hop in place a few times. Very good. Now what I'm going to have you do is I want you to face that direction. And I want you to stand there. Oh, back up for me. Back up more. Face this way. Good. I just want you to close your eyes. Now this is the Romberg test. Here I'm assessing any drifts or anything like that. Keep your eyes closed for me. Good. Now I want you to put your arms out in front of you, palms up. And there we are going to be assessing for a pronator drift. I'm going to watch you for about 20 seconds. Good. All right, you can have a seat. All righty. Next, I'm going to be assessing your motor system. I'm going to do a quick range of motion exercise, but what I'm looking for is muscle tone, any atrophy, anything like that. So I'm going to start here. Wrist up and down. Any pain when I do that? Any pain when I do that?
No.
All right, I want you to lift your leg up, down, up, ankle up and down. Good. Other side. Any pain when you do that?
No.
No. All right, now I'm going to have your arms out like this for me. All right, I'm going to pull. You pull against me. I'm going to push. Same thing. Already good. Wrist out like this. I'm going to push up. Good. Push down. Very good. Next, I'm going to put my fingers between your fists. I'm going to test your grip strength. I'm going to try to pull my fingers out. Good. I want you to put your fingers apart like this. I'm going to try to squeeze them together. Good. And I want you to put your pinkies to your thumb. Very good. I'm going to stick my finger in. I'm going to pull them apart. Very good. So I grade +5 on all your upper extremities. Next, I'm going to move on to your lower extremities. I'm going to check flexion and extension and abduction and adduction. So first thing I'm going to do is I'm going to put my hands on top of your thighs here. Go ahead and lift up. Good. Go ahead and press down. Good. Then I'm going to have you press out. Good. Press in. Good. For your knees, I'm gonna have you press up. Good. Press down. Good. Leg. Yep. Good. Ankles. I want to see gas pedal. Good. Pull up. Good. Gas pedal. Up. Good. Alrighty. Tested your lower extremities. Next, I'm going to be assessing your sensory system. So the first thing I'm going to do is grab a little cotton swab here. And I'm going to be touching a couple places on you. I just want you to let me know where I'm touching you, okay? Close your eyes. Or actually, I want you to tell me if you feel rough or soft.
Soft. Rough. Soft. Rough. Soft. Rough. Soft. Rough.
Very good. Next, I'm going to be testing your vibratory sense with my tuning fork. I'm going to strike my tuning fork. And I'm going to put it on your finger. You let me know if you can feel the vibration.
Yep.
Good. Let's do it on this finger too.
Yep.
Good. Toes.
Yep.
Other toe.
Yep.
Good. And then next we're going to test your joint position space. So what I'm going to do is I'm going to have you lift your foot up for me. And I'm going to have you close your eyes and you're going to tell me if I'm pushing your toe either up or down, okay?
Down. Up. Down. Up.
Good. Other side.
Down. Up. Down. Up.
Very good. Next, I'm going to be checking your deep tendon reflexes. So I'm going to have you sit on those pillows for me. So your legs are dangling. So I'm going to be assessing your bicep, your tricep, your brachioradialis, your patellar, and then your Achilles. First thing I'm going to do is I'm going to have your arm here. I'm going to put my thumb here. I'm going to strike my thumb. Very good. That's a +2. Next, I'm going to have your arm out like this. I'm going to support your arm here. Good. +2 there. And finally, your brachioradialis. Good. That's a +2 there. Next, I'm going to move on to this arm as well. We're going to do the same thing. I'm going to strike here. Kind of bend your arm a little bit. Good. Good. Arm up again. Good. Very good. +2 there as well. Next, I'm going to move down to your knees. So I'm going to have you, yep, good. Very good. Good. So you have +2 on both of those. Finally, we're going to move down to your ankles. Good. +2 there. Good. +2 there. And then finally, I'm going to check your plantar reflex, which is going to be a Babinski sign. We're going to test on both of your feet here. We'll start on this side if that's okay. Good. Last but not least. All right, very good. Negative Babinski sign, which is what we expect. Alrighty, that's the end of our neuro exam. Thank you very much.